Addiction treatment works best when people have stability. That means reliable access to medication, regular medical care, and support systems that don't constantly fall apart. Researchers studying GLP-1 drugs are now finding something unexpected. Medications originally designed for diabetes and weight loss may also help reduce some behaviors linked to addiction. For many Americans struggling with substance use disorders, that possibility could become extremely significant. The implications go well beyond weight loss or diabetes management. If future research continues pointing in the same direction, these drugs could eventually become part of addiction-related treatment plans. That would put even more pressure on a healthcare system that is already dealing with high drug costs, inconsistent insurance coverage, and ongoing access problems. Interest in this area grew after several major observational studies reported measurable improvements in addiction-related outcomes among people taking GLP-1 medications. One of the largest studies focused on U.S. military veterans. Researchers looked at more than 124,000 patients with no prior history of substance use disorders and compared them with more than 400,000 patients taking another type of diabetes medication, known as SGLT2 inhibitors. According to the published reporting, patients using GLP-1 drugs showed 25% lower odds of opioid use disorder, 18% lower odds of alcohol use disorder, 26% lower odds of nicotine use disorder, and 20% lower odds of cocaine use disorder compared to the other group. Researchers also analyzed data from more than 81,000 patients who already had substance use disorders. Within that group, GLP-1 use was linked to a 39% lower overdose risk, 31% fewer addiction-related emergency room visits, 26% fewer addiction-related hospitalizations, and a 50% reduction in addiction-related deaths. Those findings have shifted attention toward a larger question. Researchers are now examining whether GLP-1 medications may affect the brain systems tied to reward-seeking behavior and compulsive habits. According to researchers involved in the reporting, GLP-1 drugs may interact with dopamine-related reward pathways in the brain. The thinking is that the same process reducing food cravings could also influence urges connected to opioids, alcohol, nicotine, and other addictive substances. The effects being discussed extend beyond substance use alone. Interruptions in addiction treatment are often tied to unstable employment, repeated hospital visits, emergency medical care, and long-term financial stress. Because of that, a measurable reduction in overdoses or emergency visits may also point to broader improvements in daily stability and healthcare outcomes. Researchers have also been looking into possible links between GLP-1 medications and reduced alcohol consumption, changes in compulsive eating behavior, and other reward-driven habits. At the same time, researchers continue stressing that the evidence is still early. Most of the available studies are observational and retrospective. Researchers found associations between GLP-1 use and lower addiction-related outcomes, but that does not prove the medications directly cause those improvements. The studies were not designed as randomized clinical trials specifically testing these drugs as treatments for opioid addiction. Public discussion around GLP-1 drugs has also started moving faster than the research itself. One widely repeated claim says these drugs reduce opioid cravings by 40%. That specific figure could not be independently verified in the peer-reviewed reporting connected to these studies. The closest confirmed number involved a 39% reduction in overdose risk among patients who already had substance use disorders. Reduced cravings and reduced overdose risk are not the same thing. Researchers are still trying to determine exactly how these medications affect addiction-related behavior and whether those effects remain consistent over longer periods of time. Some physicians are reportedly prescribing GLP-1 drugs off-label in attempts to reduce alcohol or drug cravings. That possibility adds another layer of pressure to an already strained system involving affordability and medication access. These medications remain expensive for many Americans. Some patients pay hundreds of dollars per month out of pocket, while others may pay more than $1,000 monthly without insurance coverage. Insurance coverage for obesity-related treatment also remains inconsistent across employers and health plans. If demand continues expanding beyond diabetes and obesity treatment into addiction-related care, pressure on supply and pricing could increase even more. That pattern has already been seen throughout the GLP-1 market. Rising demand has contributed to shortages, inconsistent pharmacy availability, and treatment interruptions for patients who already rely on these medications for existing conditions. Every new use for these drugs increases competition for access in a system that is already struggling to maintain stable supply. For people managing chronic health conditions, delayed prescriptions, interrupted treatment schedules, and changing insurance policies are not abstract healthcare issues. They directly affect routines, financial stability, and long-term healthcare consistency. Researchers and healthcare institutions are continuing to study whether GLP-1 drugs could eventually become part of formal addiction treatment. Right now, there is still no FDA approval allowing these medications to be used specifically for opioid use disorder treatment. What researchers do have is growing evidence suggesting GLP-1 drugs may influence addictive behavior in ways that were not originally expected when the medications were first developed. At the same time, these medications remain expensive, demand continues rising, and access remains uneven across the healthcare system. GLP-1 drugs are no longer being viewed strictly as weight loss medications. Researchers are increasingly studying their possible effects on behavior and addiction-related outcomes, while concerns around affordability, insurance coverage, and medication access continue growing alongside demand. If you follow healthcare access, behavioral health, and the real-world effects of GLP-1 medications, subscribe to Dose and demand for more coverage on how these drugs are changing everyday life in the United States. The discussion around GLP-1 medications is no longer limited to obesity or diabetes treatment. Their possible role in addiction-related care raises broader questions about affordability, access, and how healthcare systems respond when one class of medication begins affecting multiple areas of public health at the same time. What happens if medications originally developed for obesity and diabetes eventually become part of addiction treatment as well, while affordability and access are already under pressure? Share your thoughts in the comments.